symptoms are quite familiar, and very likely you'll come up with a correct diagnosis. Yes, it looks like a cold, a common cold. Runny nose, headache, achiness, very often a slight fever. Those are some of the symptoms of the common cold. Well, how do we get into that unhappy state?
Health is a constant human concern. It affects all of us for our entire lives. But this year saw a health crisis of a size that many have never experienced before, and will never experience again.
How upsetting would you say this pandemic has been?
Hugely upsetting for lots of reasons. I mean, mainly the death toll, but also the devastating effect that it's going to have on people's lives, and things like the job losses and the effect on the economy, which of course will feed into even more deaths. So there's that sort of very wide scale picture, but there's also been lots of upset in terms of colleagues and family.
I think the best thing has been the medical workers and all their support workers who've just been incredibly heroic and impressive and exceeded all expectation. You know, they don't expect that they might die from going to work. So I think they've been incredibly brave. I think society has seen another side to itself by being stuck at home and really needing one another. I think that's flushed out who matters in your life, which maybe you're busy and you don't notice, but now I think we all notice a lot more who's important and who we're missing. But there are all sorts of terribly poorly paid people who we've taken for granted, who are actually saving the day. And I don't know how much this really will change for them, unfortunately, because these things tend to regress.
Is there any changes in particular that you, for example, would like to see?
Yes, I mean, I'd like to see a commitment to the NHS as a public service, which means no privatisation, and take services that have been privatised back in-house. Well, it's very. I think it's very distressing to see the numbers of healthcare staff who died, for example, where a major factor has probably been difficulties in supplying personal protective equipment. So I think they're potentially avoidable deaths. And then I think the issues for medical staff in terms of the stress, all healthcare staff, not just doctors, in terms of the stress of having to deal with the pandemic, I think that's going to cause considerable mental health problems. And in China, it's become clear that a kind of post-traumatic stress disorder has been quite common in healthcare.
It's clearly put a massive strain on the staff who've been some of them pushed into the front line. Not all of them would have necessarily been expected to be on the front line of dealing with the kind of intensive care units that needed to be expanded, developed. Hospitals have had to basically completely reorganise what they do, drop a lot of the routine work. So we can see, for example, people waiting for sometimes quite urgent, quite pressing elective treatment and now being put onto a growing waiting list that's expected to hit up to 10 million by the end of the year. So there's examples just recently that have just recently come to light of a contract for PPE procurement, £108 million contract handed to a company with an £18,000 assets and 16 employees. And at the end of the day, actually, if there's an emergency, no private medical system you can turn to in this country for treatment if you're knocked down by a car or suffer a coronary. So the NHS is there for you.